some lifestyle things that you can consider to reduce your recurrence in cancer cells is to incorporate intermittent fasting or fast and mimicking. There's a study that looked at women who fast 13 hours or more have a reduced risk for recurrence. And that's because fasting has impacts on your immune system. It has an impact on cancer cells. So I want to mention this. When oncologists, again, they're only focused on the tumor. That's it. But when you do the treatments, when you go through the cancer treatments, they're eliminating the tumor, but they're not getting rid of the circulating cancer cells, which is why people develop a recurrence later in life, because these circulating tumor cells or little cancer cells that are floating around, you can't pick them up on imaging. So you could do a PET scan, things look fine, like there's nothing there, MRI, whatever. But they're still floating around in the blood, and they're responsible for developing the cancer, either the initial primary cancer or secondary breast cancer. So fasting actually removes them, and they're more active during the early hours, like 3 a.m. in the morning, these circulating tumor cells. So if you're fasting, you're actually getting rid of them. If you're taking sulforaphane, if you're eating a lot of broccoli sprouts or cruciferous vegetables that are high in sulforaphane, the sulforaphane, they've shown, can actually target these circulating tumor cells, which is fantastic. And there's no conventional treatment that can target these circulating tumor cells. So fasting 13 hours or more can be very beneficial, and easy way of implementing that fasting protocol is to just do time restricted eating. Fast in 16 hours, eat within an 8-hour window, and you should be fine. The fast and mimicking, I'll talk about that, but that's another one that I do for cancer patients and people who have insulin resistance. And that form of fasting, I really like it. What I do for women who have breast cancer and they have that obesity that's attached with the cancer, I will have them do 6 cycles. Some of these women, by the way, have diabetes or they're pre-diabetic. So this is actually something you can use, even if you don't have cancer, breast cancer. You could do this, okay? And I'll go over because there's a lot of diabetes questions. But fast and mimicking, 6 cycles of fast and mimicking. So that will be 5-day fasting using a kit. And this type of fasting is different because you can eat while you're on the fast. In fact, we're going to do that in a couple of weeks as a community. That's what we're going to do, the fast and mimicking diet or fasting protocol for 5 days. And so they send you your meals, you follow the instructions, and you eat whatever they tell you to eat for that day. For day 1, day 2, day 3, there's meals that you eat. And you do it for 5 days, and there's a lot of changes that are happening internally as you're going through this fasting regimen. And then when you're done with the 5-day fast, okay, you resume a time restricted eating protocol. So you go back to how you were eating before. And then when the next month comes, you do another 5-day fasting, mimicking, and etc., all the way to 6 months. And that's for people who have insulin resistance. And I like this kind of fasting program because this is for people who have diabetes. If you are concerned about fasting and your blood sugar dropping, this is perfect. You can eat and still fast. And that's why it's called fasting mimicking, because you're still eating, but you're mimicking the effects of fasting. You get to benefit from fasting, the effects of what it does at a cellular level. So I'll have breast cancer patients do that. And you should make this a part of your routine. Fasting should be a part of your lifestyle if you want to prevent recurrence.